Hello everybody. Today's program is about viral hepatitis. Viral hepatitis. Hepatitis means inflammation of liver tissue. Inflammation of liver tissue. We have many causes for hepatitis. Infectious hepatitis, and toxic hepatitis. Toxic hepatitis. For infectious hepatitis, we have some important virus. HIV, HBV, HCV, HDV, HBV, and some other, of course rarely and seldom, cause of hepatitis. And also another type of virus, just as CMV, cytomegalovirus, Epstein-Barr virus, yellow fever virus, all of them causes viral hepatitis. Sometimes we have bacterial hepatitis. Bacterial hepatitis, for example, Leptospira interrogans. Leptospira interrogans, that I will teach you in bacteriology. Leptospira interrogans, and also Treponema pallidum. Treponema pallidum can cause hepatitis, bacterial hepatitis in human disease. And sometimes some parasites are the cause of hepatitis. For example, leishmania, and also amoeba. For example, Entamoeba histolytica causes hepatitis with parasite origin. And I told you sometimes we have toxic hepatitis. For example, alcoholic hepatitis. Alcoholic hepatitis in alcoholism, for person that consume about 500 cc alcohol each day for 10 years. In occupational, about 10 years, 500 cc alcohol each day for 10 years. Alcoholic hepatitis. And also, we have medicinal hepatitis. Because you know, most of drug metabolism is in liver tissue. For example, isoniazid and rifampin. Isoniazid, drug of choice for tuberculosis, and rifampin causes medicinal hepatitis. And also, we have chemical hepatitis. Chemical hepatitis with some elements, just as lead, just as zinc, just as iron. They causes chemical hepatitis. But today, our focus is based on viral hepatitis with these 5 important types of viral hepatitis: HIV, HBV, HCV, HDV, and HEV. Welcome. HIV or hepatitis A virus. Hepatitis A virus. The family of HIV is Picornaviridae. Picornaviridae. As you know, Viridae in the name of virus means family. Picornaviridae. And the genus of virus is Hep-Arnavirus. Hep-Arnavirus or hepatovirus. Hep-Arna or hepatovirus. HBV or hepatitis B virus. Hepatitis B virus family is Hep-Adenoviride. Hep-Adenoviride. And the genus is Orthohepadenovirus. Orthohepadenovirus. The genus. Hepatitis C virus family is Flaviviridae. Flaviviridae. And the genus is Hep C virus. Hep C virus. Hepatitis D virus or Delta virus family is unclassified. Unclassified. But the genus is Delta virus. Delta virus. Hepatitis E virus family is Caliciviridae. Caliciviridae, older of course, and newly is Hepaviridae. Hepaviridae. Caliciviridae or Hepaviridae, and the genus is Hep E virus. Hep E virus. They are important family and genus. The first, HIV family, Picornaviridae. The genus, Hep-Arnavirus. B, Hep-Adenoviride. The genus, Orthohepadenovirus. Hepatitis C, Flaviviridae, and A virus, double-stranded DNA virus. But the rest of them are RNA, single-stranded RNA virus. Single-stranded RNA. All of them are DNA, all of them RNA. The exception is HBV. Very good. The way of entrance or transmission. The way of entrance or transmission for HIV and HEV is fecal-oral route or feces, or contamination, food and water with feces, or fecal-oral route. Fecal-oral route. The way of transmission. But in HBV, HCV, and HDV is parenteral or transfusion or blood transfusion. Parenteral. In HBV, HCV, and HDV. HBV, HCV, and HDV causes chronic infections. Chronic infections. And also are the cause of malignancy or hepatocellular carcinoma. HBV, HCV, and HDV. But HIV and HEV have no carrier, and they have only acute phase and self-limited after the termination of disease. After termination of disease. I told you HAV is single-stranded RNA, positive stranded. The configuration of nucleocapsid is icosahedral or polyhedral, and it has 32 capsomer in its capsid. 32 capsomer. And also HAV has 4 polypeptide, VP1 to VP4. HAV. HBV in some patient and contaminated persons has 3 morphologic forms. HBV. Some of them are small spherical with 22 nanometer in size. 22 nanometer in size, small spherical. Some of them are tubular or filamentous. The size is 200 nanometer. And the third form is large form. That the size is about 42 to 45 nanometer. Large form has complete structure of viral hepatitis. Large has complete form of viral hepatitis, and it's famous to Dane particle. Dane was the first scientist, Australian scientist, that discovered HBV, Dane particle. In HBV virus, we have 3 important antigen. First is HBs antigen or surface antigen. The primitive antigen that is positive in HBV infection is HBs antigen. The primitive. And HBs antigen means hepatitis B infection. And it is outer antigen of HBV. HBs antigen surrounded to another antigen, HBC antigen or core antigen, and also HBE antigen or entrance or enter antigen. HBs antigen has surrounded to inner core or HBC antigen and HBE antigen. This antigen and their antibody against of this antigen are important for diagnosis in serologic tests. HCV is non-A or non-B hepatitis. Non-A or non-B, non-A, non-B, NA and NB. This is single-stranded RNA with positive polarity, and the shape of structure is linear. The prevalence and incidence of HAV and HBV is high. The prevalence is high. but in HCV is intermediate. HCV, the prevalence is intermediate. HDV is single-stranded RNA with negative polarity. And also, the size of virus is 35 to 37 nanometer. HDV is defective or incomplete virus and so dependent to HBV. HDV is defective or incomplete antigen and virus because the inner core of HDV is surrounded by HBs antigen. HDV is dependent to HBV because it is defective virus. And HEV character is similar to HIV.
Positive.
Of course, some of them may be quasi-enveloped. Because it is non-enveloped HIV, but sometimes in HIV we have quasi-envelope or similar envelope, like envelope. HIV is the most common cause of epidemic hepatitis. The most common cause of epidemic hepatitis, especially in Eastern of Asia, in Japan, in China, in Vietnam, and Korea. The most important cause of hepatitis is HEV. You tell me which of these viral hepatitis is defective virus? Defective or incomplete? Which of them? HDV. It's dependent to HBs antigen because HBs antigen surrounded this antigen. The HDV infection can increase the severity of infection of HBV infection, and the morbidity and mortality would be high. But HEV in pregnant women is so important, with 30% mortality in pregnant women. I told you about classification of hepatitis. We have two types, infectious and toxic hepatitis. Viral, bacterial, parasite, and also alcoholic and medicinal and also chemical. And we have some classification, important hepatitis, A, B, D, C, and B. E. About the incubation period, HAV. HAV is short periodic hepatitis. Short periodic hepatitis. Duration of incubation is about 15 to 45 days. 15 to 45 days in HIV. HBV is long periodic hepatitis. Long period, HBV. About 15 and sometimes 20, and in some references about 45 to 160 days. HCV is about 15 to 150 days. HDV is about 30 to 60 days, and HEV about 50 to 60 days. In hepatitis, we have primarily liver infection. We have two types of transmission, enterically or foodborne. Enterically or foodborne by HIV and HEV, and also in bloodborne or parenterally we have HBV, HCV, and HBV. And another cause of viruses can involve and infected the liver tissue are yellow fever, cytomegalovirus, rubella, mumps, Epstein-Barr virus, and herpes simplex type 1 and 2. I told you the size of HIV is 27 nanometer. Non-enveloped viruses or naked viruses, and it is positive sense RNA. The pathogenesis begins by foodborne infections or fecal-oral route. Just as non-enveloped virus, the entrance and the exit of virus is by lysis. Some important symptoms and signs. After 1 to 2 weeks, incubation of virus, we have some general symptoms and signs, just as fever, chills, nausea, vomiting, and abdominal pain. And after 2 weeks, we have icterus period. Icterus period or jaundice period. Icterus or jaundice period. Icterus or jaundice. Jaundice begins when the titer of bilirubin elevated. When the bilirubin increase more than 2.5 milligram in 100 deciliter, we have jaundice. Increase of bilirubin causes jaundice, and we have yellow color of eye and skin. Yellow color of eye and skin. Jaundice means yellow color of skin and eye. Sometimes we have vomiting, nausea, fatigue, fever or high temperature, about 38 temperature, yellow skin and yellow eyes due to increase of bilirubin, and also sometimes abdominal pain, joint and muscles, and sometimes diarrhea, dark urine, and pale stool. About 99% of HIV infection would be better after about 45 days. Or we have a resolution of disease. After 45 days, we have a resolution or decrease of disease in HIV. But in HBV, we have some important complication, especially in some specific person. For example, in leper disease, in lymphoma, Hodgkin, in personnel of laboratory, an immunocompromised person, and also in drug abusers. HBV infection in drug abuser is so important. The source of HBV infection is HBs antigen positive. The source of HBV is HBs antigen positive. Person with HBs antigen positive. After infection by HBV, we have some complications, some important complications. About 1 to 2% we have fulminant hepatitis. It is so fatal. It is so fatal with high mortality rate. So fatal with high mortality rate. In fulminant hepatitis, we have severe necrosis of liver tissue, severe necrosis, and it needs to liver transplantation. Fulminant hepatitis needs to liver transplantation because it's so fatal. The second complication after HBV is chronic infections. chronic infection. About 3 to 5% of HBV infection is chronic. In chronic infection, we have only HBs antigen positive. In chronic infection, we have only HBs antigen positive. No complication, no symptom, and no signs. It is so important because they are the source of infections. HBs antigen, especially in operation room, in dentistry, and in laboratory personnel, maybe spread this virus to another persons. The third complication after HBV infection is chronic active hepatitis, or CAH, chronic active hepatitis. In chronic active hepatitis, we have damage of liver tissue, necrosis, and degeneration. Damage of liver tissue, necrosis, and degeneration. About 10% of CAH goes to liver cirrhosis, and about 10% from cirrhosis goes to hepatocellular carcinoma. It is dangerous situation.
Autoimmune disease.
No autoimmune system. Maybe goes to autoimmune in chronic situation.
Yes, chronic active diabetes.
Yes, after chronic situation, sometimes we have autoimmune disease. But the first of disease, only complication, not autoimmune. And finally, we have chronic persistent hepatitis. Chronic persistent or CPH. In CPH, we have hepatomegaly, and also elevation of some liver enzyme, just as SGPT or ALT and SGOT or AST. SGPT and SGOT or ALT and AST elevation in chronic persistent hepatitis and also hepatomegaly. You tell me complication of hepatitis B. The first is fulminant. You can see about 95% of HCV infections belongs to blood transfusion. Also, in another situation, just as in transplantation, special kidney transplantation, and also in some condition, just as tattooing on the skin, we have HCV infection with higher rate. About 30 to 50% of HCV infection is chronic. About 30 to 50% of HCV infection led to chronic infections. And also in HCV infection, we have elevation periodic of SGPT or ALT. We have periodic increase of SGPT due to HCV infections. HCV infection is important for parenterally and from transfusion, blood transfusion, and also in hemophilic patients and drug abusers. And also in some races, just an Italian we have increase of HDV infection. HDV infection can accelerate and increase the HBV infections.
Because it's not complete.
Yes, because it's not complete, it's defective virus. Yes. And HEV, as I told you, is the most common cause of epidemic hepatitis. Which virus cause epidemic hepatitis? Which type? HEV. HEV. Which virus can elevate periodic SGPT enzyme? Periodic HCV. Very good. Which virus can sample of your question? For example, when I ask you for some question, it means they are the sample of questions. In hepatitis A, the disease is milder in children than adults. The first immunoglobulin in all of hepatitis that elevated is IgM. It's the first antibody. And the second antibody is IgG. Of course, it remains for some years in all of type of hepatitis, especially in HBV and HCV. For control of HAV infection, we need vaccine, serum immunoglobulin in near family, and also public health is so important, and personal washing, just as hand washing, is so important. I told you about HBV, the only type of viral hepatitis that it's double-stranded DNA virus. The life cycle and replication of HBV is some different to another DNA viruses. One of the strand of DNA is incomplete, and it needs to DNA polymerase enzyme for complete. When it completes, it will transcript to single-stranded RNA. It transcripted to single-stranded RNA, and it has positive polarity. And then by reverse transcriptase enzyme, as you know, in two viruses, hepatitis B virus and also HIV, we have reverse transcriptase enzyme. Reverse transcriptase enzyme can copy DNA virus, single-stranded from RNA. Yes, converting from RNA to DNA. And then we have duplication, and we have double-stranded DNA. And also we have degradation. A part of one of strand may be defect again.
Double-stranded complement and uncompleted.
Double-stranded.
Complements and uncompleted.
Not completed. One strand is not complete. One strand is complete, and one strand is complete, and it maybe lose a section and It's part of stranded. Yes, yes. Just as the primitive viruses. The cause of this type of replication is severe integration of virus to host cell chromosome. The cause is integration of virus to host cell chromosomes. I told you the source of infection is blood, and we have some situation, the primitive antigen is HBs antigen, and it goes to liver, and we have primary and secondary viremia, and in this step, we have immune complex. When we have chronic situation, we have immune complex circulation. And some immune complex disease just as rash, polyarthritis, fever, hive, and glomerulonephritis also. This is yellow fever of eyes and skin, or jaundice. Jaundice, you can see yellow color of eye. And also in the skin. Sometimes we have itching, right upper quadrant pain, nasal brachial malaise, and also dark urine and pale feces. This is chronic hepatitis. This is cirrhosis or complication of chronic active hepatitis. And this is hepatocellular carcinoma due HBV infection and HCV infections. HBV infection has two fates. Most of them, about 95% cure or curable. And sometimes causes to cancer or hepatocellular cancer.
Like HIV.
Yes, yes. For diagnosis, in HIV infection, rapid test, just as ELISA and immunofluorescence or IF test are so important for measurement of antibodies in HIV. And also, if you would have electron microscope, you can observe the feces because the virus spread to feces. And observation by electron microscope, transmission or scanning is useful for diagnosis. But in HBV infection, I told you the primitive test or primitive exam is HBs antigen positive. It's the first test for diagnosis. But sometimes we have decrease of HBs antigen and also HBs antibody has not elevated enough. In this period, we have window period. Window period is duration time between decrease of HBs antigen and elevation of HBs antibody. In this step, only anti-HBC antibody is useful for diagnosis. When you have elevation of IgM, it means acute hepatitis. When you have IgG elevation, it means chronic hepatitis due to HBs infections. Window period is only situation that another test is useful, anti-HBC against HBC antigen.
And the window virus, they don't have vaccine.
Yes, maybe. maybe would have some complications, some symptoms and signs in winter periods.
Yeah.
Yes, maybe. And it is so important, the history of patient and some another test for control of situation. For diagnosis of HCV infection, anti-HCV is so important. Anti-HCV. And for diagnosis of HDV, anti-HDV, or elevation of antibody or serology test is important. And also in HEV, the epidemic of disease is so important because some person may be involved by HEV, just as Asia. And also anti-HEV may be increased. As usual as in person with viral hepatitis. In person with viral hepatitis, we need to 4 examination or 4 tests. First, HBs antigen. Second, anti-HBC. Third, anti-HAV. And 4, anti-HCV. You tell me the first examination for diagnosis of source of hepatitis. First, HBs, yes. Second, anti-HBC. The third, anti-HAV for HIV infection. And no window period. Anti-HCV for diagnosis of HCV infection. 4 examinations is necessary. HBs antigen, anti-HBC, anti-HIV, and anti-HCV. If you would have elevation of IgM in all of type of hepatitis, it means acute. And if you would have IgG elevation, means chronic hepatitis. Also, you can use from rapid test molecular, just as PCR, and type of PCR for detection, isolation, and diagnosis of hepatitis. Uniplex, multiplex, real-time, nested PCR, and ARMS PCR are helpful for diagnosis of hepatitis. Well, you tell me, window period is related to which type of hepatitis? Window period. Yes, you know. Yes, you know. Window period. Window period is related to HEV. HAV infection doesn't need to specific treatment because it has only acute phase. And symptomatic treatment is so important. Bed resting and high calorie food is a good situation for HIV infections. And also it will control with gamma globulin or immunoglobulin. And also HIV has 2 types of vaccine. 2 types of vaccine with 1 month distances. For HBV treatment, the best drugs are interferon or antiviral drugs, interferon alpha 2A or Pegasus, entecavir or baracloid, and also tenofovir or Virial. They are the best drug for control of HBs virus. Hepatitis B, only for HB virus. Interferon alpha 2A or Pegasus, entecavir or baracloud, and tenofovir or virion. Also, you can use vidarabine, ribavirin, acyclovir, corticosteroid, azathioprine. They are so useful, but the efficacy of 3 antiviral drug is the best for control of HBV. For control and treatment of HCV, the best drug is Sovodac. Sovodac is combination of sofosbuvir and daclatosavir. For 3 months, sofosbuvir and daclatosavir. The best drug for HCV is sofosbuvir and daclatosavir or Sovodac. About 99% accuracy. Of course, in chronic infection due to hepatitis C virus, we can use from chemotherapy by azathioprine and some corticosteroids also. In patients with hepatitis involvement, alcohol and also some drug that metabolize in liver tissue is contraindicated because maybe increase the situation of patients. About prophylaxis or prevention. For control of HIV infection, gamma globulin, and also 2 type of vaccine is so important, and it will control the disease. For control of HBV infection or prevention against HBV infection, we have 2 types of immunity, passive immunity and active immunity. Passive immunity with using of HBIG, hepatitis B immunoglobulin, hepatitis B immunoglobulin. It is important when the virus has not entered to the cell and it's in circulation or bloodstream, HBIG. It neutralizes the virus in circulation. And also we have 2 types of vaccine for control of hepatitis B, 2 types. First is Energix B. Energix B that prepared from HBs antigen positive in safe patients. Prepared from HBs antigen positive. Energix B or plasma vaccine. And the second is Recombivax vaccine. The second is Recombivax, or a type of subunit virus vaccine. I told you in previous session, subunit virus vaccine. The accuracy of this vaccine is about 90% for 5 years. And we need 3 doses of vaccine. The first vaccine, for example, in newborn, 1 month later, and after 6 months. 3 doses of vaccine. Sometimes after 5 years, we need to booster effect. Of course, you need to measurement of antibody, HBs antibody, and if you had fail of antibody or HBs antibody, you need to booster vaccine. 1 dose booster vaccine. In hepatitis that transferred from mother to child, you need to injection of HBIG and one of this type of vaccine. For example, Riconvivax. You have only 12 hours time for this injection. 12 hours after delivery. In this side HBIG, and in this arm you can inject the vaccine. You can inject the vaccine to pregnant woman. It has no problem for pregnant woman. The vaccine of hepatitis B. For control of HCV infection, of course we have no vaccine, but we must control blood in organizational blood control. And if it had anti-HCV positive, we cannot use from this blood and must out this blood. Anti-HCV positive means you must out this blood. And sometimes you can control the severity of disease by using of some immunoglobulin. For control of HBV, when you vaccinate person against HBV infection, it will control HDV because HDV is yes, uncompleted or defective. And for control of HEV, we have 2 type vaccine. One is Klein-Smith vaccine or Belgium form, Klein-Smith with about 95% efficacy. And Chinese form or Xiaomen vaccine, Xiaomen Innovax vaccine with 100 efficacy against HEV, because I told you HEV is so problem in Eastern of Asia. And in this vaccine you will control HEV infections. Any question about viral hepatitis? Any suggestion? Any recommendation? Any experience?
I don't understand the meaning of
I told you we have 2 types of vaccine, energetic speed and Riconvivax. 3 doses of vaccine is necessary. Sometimes after 5 years you need 2 booster and another dose of vaccine or 4 vaccines. The vaccination begins at birth, 1 month, 6 months, and about 9 to 12 months. Sometimes in, of course, forced protocol. I told you HDV is dependent to HBV because this is defective. About 5% of HDV infection causes co-infection with hepatitis B, 5%. But most of them, about 90 to 95%, is super infection.
القناة تشتغل حتى لو بس ما تحمل الملف بس شوف اسمه موجود.
You can see serologic pattern of hepatitis C just as hepatitis B. hepatitis C, flabby vivid. And the cause of hepatitis C, you can see during operation, during pregnancy, and during childbirth, during sexual contact, and with donor blood transfusion, which is the most way, and use of non-sterile needle for injection. HCV, just as HPV, can cause cirrhosis and hepatocellular carcinoma. Symptom of hepatitis C is just as HIV, but the duration is long. But the progression may be the compensation of hepatocellular carcinoma. HEV is so important in pregnant women because it causes 30% mortality rate in pregnant women. And also it is the cause of epidemic hepatitis. I told you SmithKline and Xiaomeninovax. Hygienic hand washing can save several lives from hepatitis infection. The type of hepatitis, infectious and enterocolic, or foodborne, or oral food, or fecalic. And any question about hepatitis, about herpes, about general virology, about bacteriology? Each section, do you have any question? Thank you so much for your attention.